Okay, let's go for another lecture. This time we're gonna see endocarditis. Endocarditis means inflammation of the inner layer of the heart. The heart's wall is made up of three layers: the epicardium, which is the outermost layer, the myocardium, which is the muscular layer, and then the endocardium, which is the layer that gets inflamed in this case. Okay. As always, here you have the objectives of the lecture. Alright, so it turns out that most cases of endocarditis are due to a microbial infection of the endocardium, usually involving the endocardium lining of the cardiac valves. And why the valves? Well, it turns out that the valves have tiny blood vessels that nourish them, even though they are flopping around in blood all day long. This means that an infection can potentially result from a damaged valve because it would allow microbes to escape the tiny blood vessels and invade the valve tissue, or on the flip side, microbes in the blood that is circulating through the heart might enter the tiny vessels within the valve. Either way, a microbe has to first get into the bloodstream, and that might happen if a person has an open wound or an abscess, a dental or surgical procedure, or an injection with an infected needle or an infected substance, like when using illegal drugs. Most often, the valve on the left side, that's the mitral valve and the aortic valve, are affected, sometimes due to predisposing conditions such as mitral valve prolapse and bicuspid instead of tricuspid aortic valves, but it really depends on the circumstances. So risk factors for either valve include having prosthetic valves, congenital cardiac defect involving the valves, damage to the valves from rheumatic heart disease, and intravenous drug use, which typically affects the tricuspid valve. Now, the first step that happens in endocarditis is that the endothelial lining of the valve gets damaged. There are a number of ways this can happen, such as a previous inflammation or injury. This damage exposes the underlying collagen and tissue factor, causing platelets and fibrin to adhere, which forms this tiny thrombosis or blood clot. This is called non-bacterial thrombotic endocarditis, or NBTE. It's not bacterial because it happens even before the bacteria shows up. Now, if you add in bacteremia or bacteria in the blood, you've got yourself a recipe for infective endocarditis. Every day, there are opportunities for microbes to get into the bloodstream, whether it's through brushing your teeth and having them slip into the gums, or having them slip through your gut or lungs. Whatever the case, they regularly make their way into the body. And this is not usually a problem because it's a small amount and they can be easily killed by the immune system. However, occasionally they float around in the blood for long enough to find an NBTE, which serves as a perfect location for them to attach and set up an infection that is called a vegetation. To attach to the NBTE, a lot of bacteria species use proteins on their surface, they are called adhesins, that let them stick to the valve and stick to one another. They also create an extracellular matrix around themselves. We call that biofilm, which allows them to literally stick together and form a large clump of bacteria that can behave like a colony. Usually, these guys stick to areas of lower pressures since it's easier. So let's take a mitral valve regurgitation, for instance, where the blood flows backwards from a higher pressure left ventricle to a lower pressure left atrium. So in this case, vegetations will tend to form on the lower pressure atrial surface. Now, only will them form here. No, they will also form on the edge of the opening due to the Venturi effect. So the Venturi effect describes how fluid pressure decreases as it flows through a narrowed opening while its velocity increases. So as blood forces its way through the opening, pressure is lower near the edges. If the person has aortic regurgitation, meaning that the blood is going from the higher pressure aorta to the lower pressure ventricle, then vegetations tend to be located on the lower pressure ventricular surface of the valve. Infective endocarditis used to be classified into acute and subacute groups based on how quickly the infection developed. But nowadays, the key is to identify the microbial cause of infection and treat it as effectively as possible. So here you have several microorganisms involved. Viridans streptococci is the most common cause. Its virulence is low, it's found in the mouth, and it usually attacks valves that have had some previous damage that resulted in small vegetations that didn't destroy the valve. Then Staphylococcus aureus, on the other hand, is a highly virulent bacteria that can be found on the skin. This guy can infect both damaged and healthy valves, and particularly the tricuspid valve. So S. aureus cause large vegetations that can destroy the valve. This bacteria is most commonly contracted from intravenous drug use. Next, we have Staphylococcus epidermidis, which is a bacteria that loves foreign prosthetic material like prosthetic heart valves. One way that the bacteria gets into the body is at the time of heart valve surgery, when it literally sticks around the valve. Another common point of entry into the body is through an infected intravenous catheter. So both of these scenarios usually happen in a hospital, so either would be considered a nosocomial infection. The two other bacterial species are Enterococcus faecalis and Streptococcus bovis, which are both normally found in the gut flora. However, when somebody has severe colorectal disease like colorectal cancer or ulcerative colitis, these gut bacteria can migrate across the gut lining into the bloodstream, which is a setup for potential endocarditis. Now, people with infective endocarditis almost always have a fever and a new heart murmur that results from turbulent blood that passes through a damaged heart valve. Sometimes the vegetations can detach from the valve, and little clumps of pathogens called septic emboli can float through the bloodstream. These guys can lodge under the fingernails, causing splinter hemorrhages, or in the palms and soles of the feet, causing small, painless, flat, and erythematous lesions that we call Genoway lesions. In contrast, there might be and immune reaction with antigen antibody complexes that form and deposit in different parts of the body. In the fingers and toes, these complexes can lead to painful lesions called Osler's nodes. And in the eye, these deposits can lead to Roth spots. In the kidney, they can lead to glomerulonephritis. Well, diagnosing the cause of infective endocarditis typically involves getting positive blood culture, which means growing bacteria from a blood sample. Also, echocardiography can be used to visualize the heart and look for vegetations or more subtle clues like the way the valve is moving. Depending on the organism that causes the infection, a prolonged course of antibiotics will be likely to be used to try to wipe out the infection, but surgery may be needed for severe cases, especially when the valve dysfunction causes heart failure. It is also important to prevent endocarditis, especially among high-risk groups, such as people with prosthetic heart valves or a history of endocarditis. And also before dental procedures, sometimes these people are recommended antibiotics. Remember that some of these microbes that cause endocarditis come from the mouth, and these people usually the protocol says they get 1 gram of penicillin 1 hour before the procedure, and 1 to 2 grams of penicillin 1 hour after. All right. Finally, there's Liebman-Sachs endocarditis, which is not infection related. This is one associated with systemic lupus erythematosus, which is an autoimmune disease, you already know, that involves antigen antibody complexes. In this case, they settle in the endocardium and cause an inflammation. These areas of inflammation can happen anywhere on the valve surface or chordae tendineae, but typically happen on the mitral valve, which leads to mitral valve regurgitation. In this case, inflammation can also happen on the atrial endocardium or ventricular endocardium. And I guess that was all for endocarditis. Thank you for listening, guys.
That's all, folks.